Do you know how many times you are supposed to have sexual intercourse in order for you to become pregnant? Well, in this video we are going to explain how many times a woman is supposed to have sexual intercourse with the partner so that you can become pregnant. And we are saying about 2 to 3 times are enough per week for you to conceive. However, do you know why? Yes, in this video we are going to explain what we call the fertile window. Which time will you target so that you can optimize that time so that you can conceive or you can become pregnant. So we are saying it's not that you need to play sex every day unless for purposes of pleasure. But if it's for purposes of recreation or what we call reproduction, then if you mark or target the fertile window, then you may need very few times in a week. And we are saying on average 2 to 3 times are enough. How do I know my fertile window? It is very simple. If you have a calendar, we know every man, every woman, except those who are below puberty and those who are in menopause or postmenopausal. However, if you are in the productive age, which is the age between 19 to 49. However, menses also occur as early as 12 years. But we are saying, the woman who is interested in becoming pregnant, how many times should you have intercourse? We're saying this should happen between 2 to 3 times. When should I know the timing? We're saying you must be able to know what we call the fertile window, or the time when you actually the ovum is out. So on this calendar, the day you first see blood, or the first day you notice blood coming out of your private part, that becomes the first day of your new cycle. And usually it is normal to have periods between day 1 to day 7. This menstruation period, or you're having blood flow. So what happens? Some women can have a flow for 2 days, which is okay. Some can have a flow for 3 days, which is okay. Some can have for 5 days, up to a maximum of 1 week. However, when you exceed 7 days, that's abnormal. Please go and seek health care so that they find out why we're bleeding more than the recommended or the normal physiological days. So after the 7th day, this 8th to around 11th day, so 8, 9, 10, 11, here these are safe days. That means you cannot actually conceive or you cannot become pregnant. But from day 11, day 12, day 13, day 14, you are able to become pregnant. This comes out as a result of what we call ovulation. Ovulation is a process by which an egg or an ovum comes out of your ovary, and it comes to the fallopian tubes, or what we commonly call the oviduct, waiting for the sperm to fertilize it. So I'm saying that the ovulation ideally, physiological, occurs on the 14th day. However, it differs among other people. It can occur earlier by 3 days. That means we say minor 3 days. So it can occur at 11th day, at 12th day, or 13th day, or 14th day. Then the other thing, it can occur plus 3 after 3 days. So it can occur on the 14th day, 15th day, 16th day, or 17th day. So we are saying from the 11th day to the 17th day, this is your fertile window. This is your fertile window. And if you mark these days on your calendar, you'll automatically become pregnant if you had sexual intercourse. So what are we saying? That if you mark on your calendar and you actually mark what we call the fertile window, or in the other ways we call them the unsafe. For those who don't want to become pregnant, we call them the unsafe days. It's the same thing. For you who wants to become pregnant, we call it the fertile window. That means if you had intercourse, you will be able to conceive and become pregnant. For those who don't want, it becomes unsafe days, so they shouldn't have intercourse, because if they do, they will become pregnant. Then these other days are safe days, from 18th day to 28th or 30th day. These are safe days. So if you had intercourse with your partner in these days, which are outside the fertile window, you will not conceive or you will not become pregnant. So hope that summarizes how many times you should have sex in order for you to become pregnant. Just in conclusion, we said that you need about 2 to 3 days per week to have sexual intercourse for you, in order for you to become pregnant. But if you can have more than that, that's also okay. Don't say doctor said we should have only 2. No. That's the minimum you can. But you can have 5, or you can have every day. That's still okay. But in case your pattern is, for example, travels a lot, works, you are in a distant relationship, comes back once in a while, then we are saying that time when he comes back, make sure you mark on your calendar the fertile window and know those days, and then make sure you have sex at least twice a week or 3 times a week. However, you can have more than that. So in summary, you need to have sex twice or thrice a week in order for you to become pregnant. And then the other thing, make sure you mark on your calendar what we call the fertile window. Because when you have intercourse, it means the sperm should be able to find the egg or the ovum in the oviduct for fertilization to occur, which fertilization will make you become pregnant. Thank you very much. I remain Dr. Siraj, your women's health specialist. And once again, if this is your first time to follow or to watch this video, I request you subscribe, and then you will get notification for our weekly updates. Thank you very much.